a really difficult time. And we really know that if you do have sex at the right time and then are able to conceive, it certainly saves money and interventions, and saves you having to come and see someone like me because you get to where you want to be. So let's talk about how you can achieve that. So the egg that is released on one occasion each month in most women is actually only able to be fertilized for about 12 hours. So that sounds really freaky because you kind of think, oh my God, I have to be having sex in that 12-hour period. But the answer is that that's the case, because the good thing is that sperm can live in the reproductive tract for 3 to 5 days. So even though the egg's only ready to be fertilized for around 12 hours, you just need to have lots of sperm sitting and waiting, having had sex in the sort of 3 to 5 day period prior to ovulation to mean that sperm and eggs are going to get together. And therefore we think that intercourse every second day is probably fine, because I think a lot of couples get really stressed that they need to have sex every night, and it just takes all the fun out of having sex. And as soon as an egg is released, then the woman's progesterone level starts to rise, and what that does is entirely changes what her cervical mucus is like, and it moves from being like uncooked egg white, which is when she is fertile and just prior to the egg being released, and once the egg has been released, then the cervical mucus becomes thick and white and tacky, and that will tell a woman who's aware of her mucus that she's no longer in her fertile phase. And sperm really need that good quality mucus to be able to swim up through the cervix. And so in practice, the best days to be having sex are 1 to 2 days prior to the egg being released. So how do you identify when you're releasing an egg? And I think that and therefore when to have sex at the right time. And I think there are a variety of ways to do that. The first way is just to look at the calendar. And if you've got a woman and you're having a cycle every, say, 28 to 29 days, then that means it is very likely that that woman's going to be ovulating around day 14. So therefore you could just put crosses on the calendar and say, look, why don't we have sex on days 11, days 13, maybe day 14, and then you're entirely covering off a slightly shorter or a longer cycle. So I think for a predictable, regular cycle, just putting crosses on the calendar is as effective as anything else. The next thing you could do is look at your cervical mucus. And not all women can pick up what their cervical mucus is like, but the fertile mucus, and therefore when to have sex, is mucus that's like egg white. So it's copious and slippery and clear and like egg white. And as soon as it becomes thick and white and tacky, then that's your fertile time over. And then there is the third way, which is to dip your urine to pick up your LH surge. And that is good. That's more expensive, clearly, than just counting days or looking at your mucus. And picking up LH surges is a really good way of detecting the right time. But it's really interesting. There was quite a big study looking at couples where half of them, they asked them to look at cervical mucus, and the other half, they gave them LH sticks, and they compared which of the two got more babies. And it was interesting that the group that they taught how to look for their mucus actually got more babies. And I think the reason for that is that if you're looking at your LH surge, then if you say dip your urine in the morning before work and you're having an LH surge and it's positive, and then you go off to work and then come home and then end up having sex late at night, then often that might be too late. So I think that detecting mucus is probably better because it allows earlier sex within the cycle and so there might possibly be more sperm sitting and waiting for when that egg is released. And the other thing that I see many people doing is measuring their basal temperatures, and they show me years of graphs, and every morning they wake up and they diligently take their temperature. And I think while basal body temperatures are a really clear way of determining whether a woman has ovulated, it actually doesn't help you to know when to have sex, because your basal body temperature increases once you've already ovulated, and it's kind of hard to have sex in retrospect. So certainly tells you that you have ovulated, but I don't think helps you with the timing of sex. So if we look at the days of the cycle according to ovulation that are best having sex, and this is the percent likelihood of conceiving, then you can see the day of ovulation, great day, the day before a great day, and the day before that a great day. But prior to that, less good, and certainly 6 days before ovulation, because sperm don't take that long, you're definitely not going to conceive, and certainly after ovulation, you're not going to conceive. So these are the days to be having sex in order to have a baby. And then this is just a graph where it's just talking about why your mucus changes. And what happens is across your cycle, and if that's menstruation here, and these are the days of the month, and this is the day you're releasing your egg, then as you grow an egg, it starts to produce more and more estrogen. And it's in response to this estrogen, as a beautiful egg is starting to mature, that the mucus becomes copious and clear and see-through. And so these are the clues that this is a great day to have sex. So this next is just what an LH stick looks like. So you basically pee on the stick, and if you're having your LH surge, you get these two lovely lines. And this is just a picture of what a basal body temperature chart looks like. So a woman's basal body temperature goes up about 0.5 degree between the first half of her cycle and the second half of her cycle. And this is in a response to a rise in progesterone. And a woman releases progesterone after she's ovulated. So this is a lovely graph where it says, yes, this woman is definitely ovulated, but if you're waiting for your temperature to go up to have sex, then it's too late, because the times when you should be having sex is back here. I get asked a lot whether or not guys should save up. So really to save up and not have sex, and that means that they're going to have lots more sperm at the right time. And the answer to that is absolutely the opposite. So we know that frequent ejaculation is actually beneficial for sperm, and so you cannot have sex too often, you cannot ejaculate too frequently, and probably if you save up for more than 3 days, you actually get poorer quality sperm, and we see an increase in DNA fragmentation in sperm. So certainly for guys, often is way better than less often, and yeah, so as often as you like, really. So there is another problem with how to time intercourse, and that's really about if you're having a cycle that's all over the place. And an irregular cycle often means you're not ovulating, and that means that probably you're not going to get pregnant. And so I think if you're having a very irregular cycle, what you should be doing is seeking help, as opposed to try to figure out when to have sex. So by an irregular cycle, I really mean anything that is less than 22 days or greater than 35 days, or a cycle that has more than 5 days variation month to month. So I think a bit of variation is fine, but as I say, shorter and longer cycles probably should be seeking help because you might not be ovulating at all. The other reason for seeking help is if you're getting periods less than 10 days after ovulation, or if you're having really, really bad pain with your periods and pain during your cycle, that might indicate that you have endometriosis. So even though you might be ovulating, it might be a sign that you really need that dealt with. And if you're having lots of random bleeding throughout your cycle, that's really abnormal. You need to be seeking help for that. And if you're worried about what your discharge is all about and you think something might be going on, then pop along and see your doctor and get some swabs just to check there isn't anything else. So I've got some questions coming in, and I thought I'd just pause at this point and just answer some questions. So someone's asked me, they ovulate on day 12, so always wonder when I should be having sex. And the answer is that if you're a day 12 person, then really having sex on days sort of 9, 11 and 12 would be perfect. And here's another one, someone's asking me if they ovulated on day 9, are your eggs maturing? Yes, you can ovulate a very mature egg on day 9. So it just means you have to start having sex really super early in your cycle and really as soon as your period is finishing. Because for a day 9 ovulation, you're really wanting to be having sex, say, on day 6, day 8, and maybe day 9. And here's Anita asking that she detects her ovulation on day 14, 15, is having sex in the week prior and 2 days post-ovulation likely to increase your chances of conceiving. But it's not, apart from the point of getting the sperm turned over. So really those times are really sex for fun, and gosh, it's important to remember that sex is about having fun as well, but those times are probably outside of the times for conceiving. But, and Anita's saying, sorry, meant the week prior to ovulation. Look, that's all good. You cannot have sex too much, and if you want to have sex for a week every day prior to ovulation, look, you're just going to really increase your chances, and that's a good thing. So then someone else is asking, is having a tilted or retroverted uterus an issue? And the answer is absolutely not. 1 in 5 women have a retroverted uterus, and that doesn't affect the ability of the sperm to swim through your cervix. But occasionally a retroverted uterus can be a sign of endometriosis. So if you had a very retroverted uterus combined with painful periods and you're not getting pregnant and you'd say given it a really good go, say your periods were really sore and you've been trying for 6 months, then I think it would be time to go and see someone. And I've got Shan who's just asked me, I was on the oral contraceptive pill for 14 years. I came off a month ago. When would you expect my periods and ovulation to regulate? And the answer is that the pill is actually out of your system within 2 to 3 days of taking it. So the idea that you need time to get it out of your system is absolute rubbish. And so I would expect that the first month off the pill, you should start to have a very normal cycle. And if you're not, you can't blame the pill. As many people do, it's probably what your underlying cycle is like. So let's carry on. I've got a couple more slides here. So what I'd like all couples who are trying to have a baby to do is really just to get really aware of your cycle. So you know what day of your cycle you're on, that you mark day 1 in the calendar, that you think about what your mucus is like, and you can check it really easily when you go to the loo, say, to pass urine. That mucus, I think, is the best way to detect great times to have sex. Ovulation kits are good, but reasonably expensive. I hear that they're cheapest off Trade Me. basal body temperatures certainly tell you that you have ovulated, and the absolute best times to have sex are 1 to 2 days prior to ovulation, and sex every second day is fine, and abstinence is really not recommended and is probably going to make things worse. So overall, I think the other thing that people want to know is when to seek help, and I think you should be seeking help if you're not having a regular cycle. So if you're having a cycle, if you're not getting periods, or you go for 2 months without a period, or you might have a period 21 days 1 month and 40 days the next, that's not how it should be, and you should be seeking help. Otherwise, go and talk to someone after you've been trying, say, for 12 months, or if you're older, say if you're over 35, maybe give it 6 to 9 months, and certainly over 40, don't take too long. I'd be along talking to someone after 6 months. I've got a few more questions. Is having a really short period a bad sign? Mine are only 1 to 2 days long, followed by a few days of spotting. Look, I think that can be within the normal range, and I think the time that we really worry about very short periods is in the scenario where you might have had a D&C, say after a miscarriage, and then you get really, really light periods. That's the time to be worried, because that can indicate some scarring inside your uterus. But 1 to 2 days of bleeding followed by a few days of spotting, I think, is within the normal range. Then I've got a question from Tanya going, we've had 3 IUI cycles, and on each time my partner has been told to abstain for 3 days prior to the treatment, as it can reduce quantity. So I think that if you have sex really frequently, then the number of sperm goes down, but the quality increases. So I think that as we get to be able to judge quality better, then we're all going that probably when you're using sperm for treatment, then probably 1 to 2 days abstinence is superior to 3 days. But I think the 3 days of abstinence beforehand is based on counting numbers, and certainly you have a better count with a 3-day interval, but sperm quality is so much more than just counting numbers. Is it possible to have asymptomatic endometriosis? And the answer is sometimes, but it's pretty uncommon to have very significant endometriosis without symptoms. And the common kind of symptoms you see from endometriosis is painful periods, pain during sex, a lot of spotting prior to the period, really bloated and nausea leading into your period, and a family history of endometriosis. Is it possible to have asymptomatic polycystic ovaries? Yes, it is, but it doesn't matter if you're having regular periods. So the only issue with polycystic ovaries is if you're not having regular periods. So there are many women with polycystic ovaries who have regular periods and are ovulating each month, and those women, their fertility won't be affected. Susie's asking, how do I check my mucus? And so what you need to do is put your fingers into your vagina, and then just around the bottom of your vagina, just stretch out your mucus between your fingers. How am I going? Badly. And just when you've got fertile mucus, then it's stretchy and clear. So look, so you have to put your finger into your vagina, get a little bit of lubrication on it, and then just go like this. And but not all women can do it. So about 80% of women can detect their mucus. So some women just don't get enough mucus to detect, and I say, well, it's not always possible. How reliable are the LH Surge strips? Um, they are reasonable, but there are some women who they don't work as well, and particularly women with polycystic ovaries, where you might have a higher sort of background LH level, and those women sometimes they don't work as well. And also the problem is that if you have a cycle that is a bit random, you end up using them over a lot of days, and so you end up spending a lot of money on LH surge. So Kirsten asked, I don't ovulate naturally, can going on the pill help with ovulation? Look, in women with polycystic ovaries, when they first come off the pill, often their ovaries might work better in terms of ovulation. So, but not always, and certainly when you're on the pill, you don't ovulate. So it's not usually promoted as a way of helping you to ovulate. I got put on the pill to regulate my period. Here's DJ. Look, and that's helpful if you're not trying to get pregnant, but if you are trying to be pregnant, being on the pill is a really effective form of contraception, and I don't think that's going to work. So I think if you're trying to have a baby, you need to be off the pill. It kind of makes perfect sense. Tanya asks, is there any evidence to support the idea of putting your legs in the air following sex? No. So women can get pregnant standing up. So sperm that once they're ejaculated in the vagina, they're very, very rapidly swimming into the cervical mucus, and there is no evidence that legs in your air, pillow under your bum makes any difference. And I probably say that about 5 times a day, so really common question to ask. Does masturbation affect time to conceive, and should we abstain from it? There is absolutely no evidence that masturbation makes any difference to the time to conceive, and that's either in terms of female orgasm or male masturbation. I think it's absolutely fine, and go for it. If you go on the pill to get periods, will this help with ovulating after you stop the pill? Only in women with polycystic ovaries sometimes. So if you're not getting periods because, say, you're too thin, say you're exercising too hard, you're too lean, and you're not getting periods because of that, then going on the pill isn't going to make a skerrick of difference. It will give you periods, but it's not going to help you with ovulating in order to have a baby when you stop. So I think it depends what the cause of your infertility, or of your lack of periods is. How long should I stay lying down for after sex? It doesn't make any difference. So lying down after sex does not increase your chances of getting pregnant, even though everyone thinks it does. And so you can get up as soon as you've had sex. So here's someone asking if I'm nearly 34 and have been trying to conceive for just over 12 months. Both my husband and myself have come back with normal tests. Is it worth seeking help? Look, it probably is, because if you've been trying for a year and you're 34 and it hasn't happened, then and you might want 2 children, I think it's time to move this along. And even if you've had some initial tests, there are probably some more tests you haven't had, and I think it's worthwhile seeking help. Here's Katie asking me that she has PCOS and am on metformin and letrozole, had a trigger shot with an 18mm follicle last month, just keep going with the same. Look, there's a time when you stop with that, and sometimes it's driven by the scoring system to get you publicly funded IVF treatment, and the deal with points to get publicly funded IVF treatment in women who don't ovulate by themselves but they ovulate with medication, then the scoring system insists that you need 9 months of treatment before you can be scored for IVF treatment. So therefore, you might want to continue, although I recommend to catch up with your doctor after every 3 months just to talk about what all your options are and just to make sure it's the right thing to be doing. Here's Saskia asking me that she's had 3 IUI attempts and I've been told I don't ovulate. Can my doctor prescribe clomiphene? Yes, although I have a view that clomiphene is better given within the context of a fertility clinic with appropriate monitoring as opposed to just your GP giving out clomiphene, because if we look at the number of triplets born in New Zealand, and I think triplets are actually an undesirable outcome in terms of the health of the babies and the health and mental well-being of the parents, then more triplets are born to unmonitored clomiphene in the GP community than all other causes of triplets in New Zealand. So my view is go and talk to your fertility doctor. So further info, we've been trying to conceive our 3rd baby for 3 years. So Katie, I think that you really need to be going back and stepping up if this isn't working. So guys, are there any more questions? Oh, here's another question. Hi Mary, what about older male partners? I have a partner in his 50s. What can he do to boost his fertility lifestyle? It's a great question, talking about the timing of sex. Look, we used to think that guys were immune from reproductive aging. It was just all about women. But we now think that guys do get a little worse from a fertility perspective as they age. And so what you need to be doing for your man is you need to be making sure he's on male antioxidant. So there are the most well publicised ones are Menavit or vitamins, and I don't know that they're better than any other general antioxidant, but that will improve sperm quality and is great for older guys. You should also be making sure that he's got a great lifestyle in terms of not smoking, minimising alcohol, and give him a great diet that contains lots of fruit and veg. And he really shouldn't be, he needs to also have frequent ejaculation as the way of improving his sperm quality. And you should just get him to have a chat with his doctor just to make sure that any medications that he's on are not reducing sperm quality. So Sarah's asked me, publicly funded IVF, that one of the requirements is a BMI of 32 or under. Is there any special dispensation for this? And the answer is sadly no. We are all audited, and pregnancy rates go down as women's BMIs are greater than 32, and the outcomes of pregnancies and the health of children are worse. So the government has said, look, please spend our money wisely and get as many babies as you can, and make sure that the babies that you make are as healthy as they can. So I'm sorry, the BMI criteria is pretty tight. Is there, and the other thing is, a woman needs to be less than 40 at the time she is scored. Other medical conditions are other things that get you points. To get enough points to score enough points for public funding are if you have endometriosis, blocked tubes, poor sperm, and the duration of time that you've been trying. DJ asks, is there any better position for sex with a tilted uterus? No. So you want to just be ejaculating into the vagina and so any position that works for you. What about supplements like Vitex and Saw Palmetto? Look, I think that there is limited data, and I'm not sure, and I see that Lula George is giving a webinar tomorrow, and she'll be talking really widely about supplements. So Lula's is much better placed than I am to talk about supplements. So why don't you go in tomorrow and talk to Lula about that? How long is the waiting list for funded IVF? Yeah, so you first of all you need to be scored by a reproductive specialist, and you can see a reproductive specialist either publicly or privately. Privately, you clearly get seen faster. You'll be seen in 1 to 2 weeks. Publicly, it might be as far as 3 months to be seen, and you could get your GP to organise that for you. And then if you score enough points, then the waiting list around the country is sadly sitting at around 12 months. Does alcohol and drugs affect the quality and numbers of sperm? Absolutely does. So more than 20 units of alcohol a week delays the time to conceiving, and I actually think you need a guy drinking less than that, and preferably not all on the same night. And all illicit drugs are bad for sperm, whether or not that's cannabis, pee, heroin, they are all bad. And there are also a variety of medications that a guy could be on that might also be detrimental to sperm. And so it's a good idea just to chat with your GP about that. Sham's asking, would you recommend zinc supplementation for males to increase sperm quality? Not a lot of data around it. I don't think it's harmful. I'm just not absolutely sure it's going to be the magic bullet. Claire says that she goes to the bathroom after sex to minimise the chances of urine infection, and that will not change your chances of conceiving. So it's perfectly fine to get up and pee after sex. And you're absolutely right, in women who are predisposed to getting urinary tract infections, peeing quickly after sex really minimises that. Can a BMI score be retested with loss of weight? Absolutely. So if you've been told that you don't meet the BMI criteria and you go away and lose 5 Ks, you should be back on the phone going, hey, my BMI is now such and such, please rescore me. Having an operation for endometriosis or had an operation for endo in 2006, now suffering from pain again. Do you think this will impact on trying for a baby, and would a possible second operation be needed? Look, yes. So I think if you've had endometriosis and then your periods have then got better and then they're getting bad again with pain, then you're probably thinking what I'm thinking, probably you're growing some more endometriosis back again. So I would actually be going to talk to someone about that, and possibly someone more than your GP. Great, everybody. Thank you. Oh, look, I've just got one more question come in. Does repeated sex over a short period improve the chances? Look, we're not absolutely sure about that. I certainly don't think it would be harmful. And what does an endocrinologist do? Well, an endocrinologist is someone who measures, who specialises in hormones. So they are a physician as opposed to a gynecologist, and so they're experts in hormone disorders like thyroid disease, adrenal disease, pituitary disease, and also have an expertise in things like polycystic ovaries. Kirsten's asking, I went off the pill after years of being on it and got pregnant straight away. Unfortunately, it turned out to be an ectopic. I have not ever had regular periods. They were usually 6 weeks apart, but after the ectopic, I've not had any periods naturally since doctors said I'm not ovulating, and we're on our third try at IVF. What do you suggest I do? Look, it sounds like you're on the right track, because I think it sounds like you've got a combination of fertility issues, tubal disease and ovulation, and sorry it's proving so hard for you.
Okay, I think that's it for people have come on and thank you. So that was a great presentation. Tomorrow night, as Mary mentioned, we have lifestyle with please join us to hear more about that. This webinar recording will be available on the website tomorrow night. And you'll be able to see the recorded copy of the presentation. So I'd just like to say thank you very much for presentation.
Thank you. Okay, bye.